What do we need to know about cold and flu season? Well, Swimming Canada's top doctor is going to tell us. Dr. Steve Keeler is the lead physician with Swimming Canada. He's also part of the clinical faculty at the University of British Columbia. Dr. Keeler, welcome, and we'll start right with this. Can you provide a quick update on where Canada is regarding the COVID-19 pandemic?
It's certainly a strange time right now. Pandemics aren't easy, and in Canada right now, we're seeing an escalation. So that certainly that anticipated second wave is upon us in most provinces anyway, and the major provinces.
What are the differences between the two illnesses? If someone's out there and they're feeling symptoms, what's the best advice you can give?
They're very similar. They both have this onset within a few days, and they can involve multiple symptoms of sore throat, cough, fever. Unique to COVID is the loss of taste and smell in some people. So to differentiate between those two and perhaps the common cold, which we're starting to see now in the community, is perhaps a little bit easier for us. Fever is not a big part of a common cold. Shortness of breath is not a big part of that, where it might be with influenza potentially and COVID. The seriousness of the illness is greater with COVID and influenza versus a common cold. Sneezing, running nose may be more related to the cold versus maybe allergy. But certainly the symptoms are a little bit more, typically more severe with COVID and influenza. COVID can cause pretty serious illness, as can influenza, but we know that it can actually spread more easily than influenza, and that's why contact tracing is critically important in slowing this thing down. We also know that perhaps the onset of COVID symptoms after a contact can be delayed versus influenza. Typically people who might develop symptoms with COVID, not all do, but can be around that day 5 period and can actually stretch out to day 14. Whereas influenza typically happens quite a bit quicker, day 1, 2, 3 post-contact. So I think it's important for people to bear that in mind if they think they're free of potential infectivity once they've been contacted. And so that's why contact tracing is really important, and to be aware of that.
So if someone out there is experiencing symptoms of COVID-19, there's a lot of overlap between influenza, the common cold, COVID-19. At what point are you recommending an individual go get a COVID-19 test?
Many provinces now have risk assessment tools to help make that decision. If you're unsure, best to isolate, stay away from family and friends, reassess yourself over a 24 to 48 hour period. And if you do feel that there's 2 or 3 symptoms that you tick off the boxes on the list that we've recommended to have a look at, then I would recommend calling your public health officials, nurses line, your primary care provider to get some advice on whether or not testing is indicated.
Now, the federal government has developed the COVID-19 app. You can download it on your phone, most phones. What is the COVID-19 app and why is it useful?
It's an alert app that if you have been in a certain area and there have been contacts with or cases of COVID, then it will notify you to be cautious about isolating symptoms, potential testing. So it's just another means of public health, a mechanism to let us know when we should be tested.
Many Canadians and a lot of people around the world are hoping that a COVID-19 vaccine is developed so that we can get back to, a safe and active lifestyle without restrictions. Where do you think the country is at currently with its development of a vaccination? And how do you think the next year is going to play out? A regular life, high performance athletes. What do you think 2021 is going to look like? Will it be a lot like 2020, or what's your assessment?
I'm hopeful. There are multiple vaccine trials now entering into clinical phase 3 trials. Some have been temporarily stalled, which is to be expected. But our public health officials are telling us that perhaps early 2021 for a vaccine. It'll be a slow rollout, probably. There will be healthcare workers and at-risk individuals will be the first to receive the vaccine. If and when it comes, there's probably going to be multiple vaccines that will be looked at, but the first and foremost is efficacy and safety with the vaccine. So it's a little unpredictable, but my sense is it's probably going to be more towards springtime. And for our swimming community and for our high performance program, hopefully well before Tokyo rolls around next summer. Speaking to the vaccine, I again would just really encourage everybody to get their influenza vaccine this year in anticipation of probably a little quieter flu season, but it will help take the burden off our hospital system if those beds are needed.
And going back to flu season, why is it important to get your flu shot this particular influenza season?
Well, for some of the reasons we've discussed, and that we don't often can easily differentiate between influenza and COVID. So it'll just take that much more pressure off testing. It'll take that much more pressure off our hospital and healthcare system. If less people are admitted, influenza is a very serious illness. Many thousands of people succumb to that illness in Canada every year. It's, we're complacent with it because it's been around for so long. And my hunch with COVID is that it may become an endemic virus, just like influenza is, where we have a vaccine for it, and we have to learn to manage and live with it over the next several years, which is probably what will come of this. I think most epidemiologists and public health officials feel that that's the case.
And any final thoughts on this upcoming influenza season and living with COVID-19 into 2021 for Canadians and our swimming community?
We all recognize the toll that COVID has taken on our mental health and on our physical health as well. And just want to emphasize to people to be patient. It's not going to last forever. There will be an end in sight to this, probably sometime in 2021 for the most part. And just be patient with it and flexible. Be supportive, be respectful when it comes to the distancing, masking, and hand hygiene so that you're thinking of others in that context. I'd also like to say, be careful with the misinformation that is out there. There are a lot of, sources of misleading myths around COVID in terms of contractility and treatments. And so use your public health officials and your primary care providers to help you along that way. I think that's really important. And I guess finally, I'd like to say that, the goal here with COVID for all of us is to not necessarily to create a zero risk environment. It's really to create a safer environment. And I think that should be foremost in our mind. And with simple measures, I believe we can obtain that. And I think most people are doing that at this time. So I'm encouraged by that.
Dr. Steve Keeler is the lead physician with Swimming Canada and a clinical faculty member with the University of British Columbia, and he is our swim expert. Thank you, Dr. Keeler.
You're welcome. Take care.